outside, it's going to contract so that the pupil is very small, and if it's dark outside, the pupil will get bigger. Hi everyone, I'm Dr. Toor from Bldg Eye Care here in Olympia, Washington, and today we're going to go over some general terms that relate to the anatomy of the eye that you may have heard. So I'm going to be using this eye model to help me out here, and we'll start at the front of the eye. So this layer here is what's called the cornea. It's a clear layer that sits in front of the colored part of your eye, and it's responsible for letting light through. It can be related to your prescription. It's also what's affected when you have dry eye or allergies. And it's important for this tissue to remain clear and let light through in order to have good vision. And then next we'll talk about the iris here. So that's the colored part of the eye. And in the middle there is what's called your pupil. So your iris and pupil actually contract or expand depending on what the environment is that you're in and the lighting. So if it's bright outside, it's going to contract so that the pupil is very small, and if it's dark outside, the pupil will get bigger. And then right behind the colored part of the eye sits the lens. So this lens is responsible for your focusing system. So when you're looking up close, the lens changes shape so that you can focus at the right distance. And then when you're looking out in the distance far away, it actually relaxes its shape so that you can see clearly in the distance there. This lens is crystal clear when you're born, and then over time it gets cloudier and cloudier, and that's what we refer to as a cataract. And as long as we live long enough, everyone gets cataracts, and that's what we're referring to right there. And then the back part of the eye here is what's called the retina, and it's a tissue with several layers that has your cones and rods and is responsible for gathering all the information and sending it off to your brain. The way that it gets sent to your brain is through the optic nerve here. So again, it collects all the information from the tissue of your retina and then sends it through the optic nerve into your occipital lobe. The optic nerve is an important structure that we watch closely, especially for diseases like glaucoma, to make sure that that tissue isn't being lost and stays healthy. The other important area of your retina is something called the macula, which would be like right about there, and that's responsible for your central vision, color vision, and the details in your vision. So that area can be affected by something called macular degeneration, usually when you're older. And that's when waste and debris starts collecting there and can impact your vision. And then lastly, the last important thing we look at the retina are the blood vessels and veins, responsible for bringing nutrients in and oxygen and then taking waste out. So we watch these closely, especially in diseases like diabetes or high blood pressure, because in those diseases, the blood vessel walls can start weakening, and that can cause leaking and some bleeding in the eye. And so we look at that using some light going through the pupil, looking back here and making sure that it all looks healthy.